again and housing me again. And I think what we want to do on today, we want to do a little bit deeper dive into the actual care message application. And I do want to ask, again, if you have any questions, and I'll try to pause after a while, after covering some things or comments or feedback. We definitely want to make sure that I'm able to address that as well. So I am going to share my screen and let's see if I'm able to get it. Should be able to let me know if you see it right now. Is everyone able to see my screen?
Yes.
Okay. I am a little bit blinded, so please let me know and stop me by audibly saying something. I can't see the chat, unfortunately, here, and then I will stop and we will make sure that we can do so. Let me see if I got it. Okay. How's that? Everybody still see my screen?
Yep.
Okay. Uh, awesome. All right. Well, let me get to it. All right. As you see here, remember that CareMessage is a web application, which means that you can log on at any time from anywhere. All you simply need is your username, which is typically your email, and your password that you can set up. And again, you can log on from anywhere at any time from a laptop or from a desk computer. We do not offer the mobile capabilities all because of PHI information that's included with some of the information you're going to be sharing. So once you log in, you're going to be directed to the dashboard. And in the dashboard is where you have an opportunity to see a couple of things that are going on. And I'm going to point those out. On the left hand side, you're going to see again what we see some of the menu items, the feature that we talked about, appointments, where we're able to help you to schedule or reschedule appointments to drive down no show rates, messenger, which is our one to one conversation, which is again a direct conversation. It is bi directional and it is HIPAA approved as well. We have our outreach, which is one to many, where you want to create groups, maybe beginning to group them based on diagnosis, or even if you want to do an outreach to your whole patient population. You can do that within outreach. We have referrals. Again, if you do offer referrals, that you can see visibility upon whether that patient has scheduled that referral with the other provider, and then you'll also be able to know whether they attended. And then, last but certainly not least, we have programs that allow the particular patients to enroll based on whatever the outcome and diagnosis, a 25-week class that will allow them to really take accountability and take the harness of their health outcomes as well. In the middle is where you will find, again, if you need any outreaches, which is one to many that needs review. These are brand new messages that come in that have not been read yet. You're able to review them here. And once you click into the message, you simply mark them reviewed and they will remove themselves, allowing room for new unread messages. Same for appointments that you're doing appointments that they're able to be reviewed brand new that have not been viewed yet. And once you review them, simply click reviewed and they will remove themselves from the list. Over on my far right, we do have which are quick action steps where if you are a do-it-yourselfer and you say, Daryl, just provide me the resource. If you want to know how to add a patient, send a message, upload a file, or send an outreach, all found here, along with general help information to allow you to best utilize CareMessage and get the most out of your patient engagement tool. And then if you just want even more information, we have our help center that also include additional resources for you to be able to navigate you to how to utilize CareMessage. But let's just say you are a touch and feel person like I am. You want to talk to someone or you want a live interaction. In this button right here, you just simply click it And you will see again your name will pop up that's been exclusively detailed to you. And you simply hit send us a message. And there you will find a customer support manager who will be waiting to assist you. That whatever question you may have, whatever help you may or assistance you may need, you just simply type it here, and then we typically will give you an idea of how much time you will have to wait before you're connected with a live support manager. Our aim is to make sure that we're providing white glove customer service, that you have to wait no longer than 15 minutes. But once they do, you can do that. And we do have interpreters on staff that if you do have a message intervention that you do want to send in, say, for instance, Spanish, then we have an interpreter on staff that all you simply do is copy whatever message intervention you have created in English, paste it here, and just ask them if they would translate that to the language of your choice. Once they translate it, they will send it back. You get an alert. You just simply copy and paste it into your outreach window. So, with that being stated, that is our dashboard. And I'm going to pause just for one moment and ask, do we have any questions, comments, or feedback? Looks like we're good to move forward. Outstanding. Okay. Please forgive me. I'm navigating between multiple screens. All right. Next, we ask, then how do we get started? If everyone is familiar with a CSV list, a comma separated value list, is what I like to describe as a glorified Excel spreadsheet. You simply go to the file center. You're going to save that CSV file. You can either import it from your EMR in a Excel platform and then save it to a CSV file, or you can create a CSV file. And once you upload the file, you want to choose what file you're going to use. It's important that you name your file so that you'll be able to access it if you want to use it for future occurrences. We will even provide you best health tips that, based on the type of actual outreach or type of feature you're utilizing, what's best use in those columns. And let me give you an example. Let's just say you want to do an outreach and you want to use your patients or you want to send it to a specific group. Well, a couple of things we would recommend is that with your CSV list, in column A, possibly include the patient's external or internal ID. Column B, make sure you put the patient's language of choice. Which language would they like to receive the text message in? Column C, patient's mobile number. That way we know which number we're texting to. And of course, as we follow on, and I think you get the cadence, first name, last name, if you want to include the group or even some of the specific demographic for patient and their information included in those other cells. And once you complete it, you want to upload it, you want to match it, make sure all the information is appearing accurately, you verify it, and then you are done. But let's just say that you've created a group and you want to review that list that you just created. You simply click to the left and you click on groups. Here you will see all the groups that you have created, along with the number of patients that are included in that group. You will also see who created that list and when it was last updated. And if you need to add new patients, you can simply use the edit button to add the new list of patients, or if that list becomes obsolete, you simply delete it here. But no matter if you're adding patients based on a group or if you're loading your whole patient population, you will always be able to find everyone here under the patients button. When you hit patients, you will see the list of the patients that you have added into Care Message, no matter if it's within a group or within a patient population. They will be added by last name in alpha order. And as you can see here, Care Message gives you the ability to scale your list also. That now, for instance, if you're really now targeting Breast Cancer Awareness Month, we all know it's in October. If you want to scale your patients list to all females within a certain age range, even by language, you're able to do so and thus being able to download and create that list of patients. So it gives you a lot of flexibility in how you are able to really either scale your list, add patients to your particular into care message, either by group or also by patient population. So with that being stated, I'm going to pause momentarily and ask, do we have any questions, comments, feedbacks before we go to the next section? Feels as if everyone is okay. We're ready to move forward. All right. Now, with that stated, let's talk about how do you thus create an outreach. Remember, outreach is one to many, where either you can do it via group that you created, or you can also do an outreach with your entire patient population. So the first thing you want to do is you want to click the outreach tab. Once you click outreach, you want to create an outreach. First thing CareMessage is going to ask is who are you targeting in this outreach? So once you hit select, you will see a couple of menu choices that you're able to select from. You can either select by patient's name, status, language, age, sex, zip code, if you've included that information in your CSV list. Hence why it's very important to do so. And then also, if you want to send it by group, you will simply click into the group. Once you click into the group, you want to find the group that you want to target, and I'll just do no flu shot on record. But what if you want to send multiple groups? All you simply do is click back into the box. Oops, sorry. Click back into the box, and you're able to add as many groups as you like into your particular selection. Once you have it, you hit apply, and now you're able to see that you have tentatively scheduled 46 patients to receive your particular outreach. You will see here again, based on the information from the CSV list, patient's first name, last name, age, sex, language of choice, contact method, whether again it's via text or via a phone call. And I'm going to circle back to that momentarily and explain what I mean by that also. So once you have it, you review your list, you simply will go to the drop down, select all. If there's someone who you want removed from the list, you just simply deselect them. And now it changes your search from 46 patients to now you have tentatively scheduled 45 patients to be able to receive this outreach. So next is you want to begin to now name your outreach so that if you want to revisit it for future occurrences, you will be able to access that outreach for further use or future use. So you want to name it. You also will see that we have text or voice. There's an opportunity where if a patient opts out of the text program, that you can simply place them under the voice so that they would receive an automatic AI voice recognition of the message that you have created here in either English or Spanish. So with that being stated, there are four types of messages you can send. There's a no response needed, where again, doesn't necessarily need for a response. It's more informational. If you're having a health fair, if you're having a food drive, clothing drive, health seminar, whatever the case might be, it's more informational here. You can have an open ended, which is the second type of message, in which now you need to have more of a further dialogue for specific information that you need to request from that patient. We also offer yes or no or multiple choice, where you're able to build out messaging intervention that's based on their answer of yes or no, or either multiple choice A, B, C, or D. You're able to already have built out various messaging that will be selected and sent to that particular patient. Let me share with you an example of the yes no. And remember, we offer well over 300 messaging intervention templates that you can use that are completely customizable. All you simply do is click under template and you find the template of choice, I'm going to say flu shot reminder in this. The flu shot reminder is a yes, no messaging format. In here, you'll see again the message will read organization name, which will be your clinic's name. Did you get your flu shot this season? Text yes or no. If the patient texts yes, when this is automatically built out, they will receive this message. Great. Everyone 6 months or older should get a flu shot every year. If anyone in your family still needs a flu shot, this is a call to action statement. Call us at. The reason why we put call us at is you want to include a phone number in which one of your staff members or volunteers will be manned and ready to pick it up because the number you're going to be utilizing to text from is going to be a separate number that will be local to your area, but it's not a dialable number. That will be the number that you would text from, in which CareMessage will incur all data charges so that neither you nor your patients will incur data charges. Or you can simply go in and you can go and simply can tailor this further and say, or text back this message. That's how easy and how flexible it is for us to be able to utilize it. Unfortunately, if you make any changes to the English, it does not automatically make the change over here to the side where it's Spanish. You would either have to have an interpreter or you would simply copy this message, go back to our customer support managers, and ask them to include whatever message that you're adding to the current template. So, with that, you can see that it allows you up to 320 characters per box, in which it gives you more than enough room to do so. If the patient selects no, they'll receive this message. Our clinic has flu shots available. We recommend everyone older than 6 months gets a flu shot once a year. Call or us or schedule your appointment at this number or text this message. Okay. Simple as that. And once you have your messaging intervention built out, then you can determine the date, the month, date, and year, and the time you want this sent. You can even determine the frequency, whether you want it once, daily, weekly, or monthly. And once completed, again, this is your template. Even if you make the changes, save as a template. And once you save it, you'll be able to access that template again in the outreach section. So, with that said, I want to pause just for a moment and ask, do we have any questions, comments, or feedback before we move forward? Looks like everybody is on board. All right. Well, we will move forward. Now, I know that some of you are thinking, man, it would be really great if in this yes, no, or multiple choice platform that we could see what the results are in order to really capture that data for future usage. Well, I'm glad that you were thinking that because there is a way to do so. As I stated again, once you go to your outreach, if you're utilizing a yes no format or a multiple choice, you simply just go to your outreach. Once you click there, now you're able to see, based on your outreach, how many patients said yes and how many said no. You're able to see the number of patients that were entered into that particular outreach, what the response rate and the retention rate was with that particular patient. Not only that, let's just say you want to scale even further. You can go into your patients and now you will see all the patients who were included in this particular outreach. Now you're able to scale your list even further by either searching by patient name status, but what if you search by response? What if you want to see all the patients who said yes, all the patients who said no, but what about those who had no response? You capture all those with no response. They show you the list. You group them. So now you can resubmit the patients who have not responded back into that particular outreach. So now you're not double dipping on those who have responded. And now you're able to really get a more complete view of what your response are based on your outreach. I think that's just a phenomenal tool. I do want to pause there and ask, do we have any questions, comments, or feedback on what we just covered thus far? Excellent, excellent. All right, then we're going to move forward. Now, what if, pray tell, one of your patients, they said, hey, I had my flu shots, but I actually want to check on my prescription. I want to know if my prescription is ready for pickup. Valerie has stated, I'm good on my flu shots. I need to know that. If you want to respond to Valerie, all you simply do is you're going to hover over Valerie's name and you're going to do direct message. That now that takes us out of outreach into Messenger. Messenger is our one to one outreach tool where, again, you're having a bi directional conversation in real time with your patient that is HIPAA protected as well. And you will see with the blue dots that you have new messages that needs to be reviewed not only on the dashboard but also when you're in Messenger in that particular platform as well. So with Valerie, what you see here that I'm scrolling on right now on the left is a historical landscape of every message that's been sent to Valerie. What this will allow you and your staff, if it's someone who needs to be really reminded or have to review a particular patient and the information that's been carried via text message, they will have an opportunity to read every message that Valerie has been engaging in text since she signed up with the program. But we want to go to the bottom, and Valerie has simply asked the question again that she wants to know whether her medication or her prescription is ready for pickup. Team, if this is something that you know that you're going to answer over and over and over again, instead of you typing that every time you get that question, is my prescription ready? What are the office hours? How about we just create a template that you can utilize and be able to paste into there every time you get asked that question? You simply click in that little icon, and now you want to name that particular template. You have 480 characters to be able to create that template. And once you create it, you save it. So now that Valerie is asking about her prescription, we spilt with the pharmacy, it is ready. Now we simply go to this folder and we select the template we want to use. And we're going to look for pharmacy pickup. We see here pharmacy pickup that it is available, that is here. And what you see here in the blue highlighted is what we call smart tags. With smart tags, the reason why we use CSV form is that CareMessage will fill in all the information that's highlighted in blue as long as it is provided in the CSV file or the particular cells. You will see again that now we have our message. It's queued up. Organization name, hi, patient first name. Your medication is ready for pickup at the pharmacy. So once you do that, you hit send. This is real time. Care Clinic, hi Valerie, your medication is ready for pickup at the pharmacy. And what's really cool is I have this number tied, I have Valerie tied to my mobile number, and I am looking at this text as we speak. So, a phenomenal opportunity where you have an opportunity to be able to engage a patient in a one to one manner based on an outreach, or if you need to reach them one to one, you can do so and be able to get a higher response rate. Because with text, people are able to review a text versus a phone call where if it's not saved to their favorites, they will allow it to go to voicemail if they have voicemail. If it is someone in their favorites, if it's not a great time, they'll still let it go to voicemail. Patient portals may have difficulties trying to figure out how to log in, as well as not having access to email. But with a text, you will be able to answer a text at any time, no matter where you are or what time of the day or how busy you may be. So I'm going to pause there for a moment and I'm going to ask, do we have any questions, comments, or feedback before we move forward? All right, then I want to circle back to one thing, and that is regarding smart text. And this is a tool I believe, without a doubt, is going to be something that's going to be a lifesaver for you because, as you notice again, with smart text, As long as you're using a CSV file, CareMessage will read that information. And the way you access additional smart tags or smart tags is you simply on your keyboard hit the shift key and the and sign, and it will bring up additional smart tags for you to be able to use. So if you have an outreach of over 800 patients, for example, now your patients will receive this particular outreach. Even though it's sent in a group one to many, it will give the feeling that it's sent specifically to them. It will say clinic's name, Daryl Belcher. Did you get your flu shot this season? Text yes or no. And what's really cool is with appointments, the same the same is with appointments. With it, you're able to utilize either our templates that you can use, or you can create your own by going there, the same as outreach. And I just want to kind of give you an overview of what the appointments feature looks like when you're utilizing a CSV list. With the CSV list, again, you're going to list out all those patients that have appointments that week. You want to put the title of the appointment, the length of the duration of the appointment. You have two types of reminders or two types of responses. One is a RSVP response reminder where you're able to allow the particular patient to schedule that appointment, or you're making them aware that an appointment has been scheduled. You see smart tags are being utilized. The clinic saying you are confirmed for your appointment on Monday, July the 10th at 12 noon. To make changes, please call this phone number, or you can again can go in and utilize additional smart tags where you can see you can implement specific times. You can also implement date, weekdays, patient's first name, last name, even if there's a copay associated, which we know with free and charitable clinic, most time there is not, but it still gives you the luxury of being able to allow outreach or an appointment outreach to feel as if it has a personal touch. Then the second reminder can be a reminder in which you are now able to remind that particular patient maybe a week before the appointment. Again, your clinic's name, Daryl Belcher has an appointment on this time. Send it a week before, and if needed, you have a third that can be sent out the day before that again will allow that particular patient to be able to respond whether they're able to make the appointment or not. And based on their answer, if it is yes, thank you for confirming. If it is no, thank you for letting us know. This helps us to make appointments available to other patients. We'll be in touch soon about rescheduling. Once that patient cancels it, if they say no, they will automatically receive this message. We apologize for your appointment on this date and time has been canceled. Please call for more information. But there is also an additional caveat that if a patient cancels, not only can they receive that message, but we also have an automated message that as long as this is toggled on under appointment reschedule via messenger, not only will they receive a confirmation of their cancellation, but they will also receive another message encouraging them what day and time works better for them to reschedule. You can either have them text it back, or again, this is completely customizable. You hit the edit button, or you can put a phone number that they can call in order to schedule. So that was quite a bit. And I'm going to pause for a moment just to entertain to see again if we have any questions, comments, or feedback before we move forward. All right. Then let's talk about this is where the part comes in and we talk about integration. With Care Message, with free and charitable clinics, our aim is to make sure, and the goal is to keep you priced accordingly because we understand the challenge of being able to write grants, fundraise, as well as do any other donations that come forth. Your funds may be very limited, but yet they go a long way. So what we did is we have allowed an opportunity for your clinic to allow an integration only with the appointments feature, and it's only for those who have Athena Health API as their EMR. Let me make sure I repeat that. Only those that have Athena Health and uh, you will have an opportunity to have a full integration with the appointments feature. The way that would work is that you would thus send all your appointments via your EMR in Athena Health into CareMessage. CareMessage will then, once you pick what messages you want to send, will send them out to your particular patients. And once the patients respond, the respond will come immediately back into your EMR. Again, because of making sure that we can price it accordingly, that is only for Athena Health. Okay. If you are a part of Athena Gives, and you're on our approved list, there also will be additional discounts that are available to you. And I'm going to cover that once we get towards the pricing portion of this presentation. Just keep that on top of mind. I'll make sure I cover it. Again, integration at this moment is only for Athena Health. And if you are part of Athena Gives and part of our approved list, I have it in front of me, then there are additional discounts that are at your disposal. So let's move forward very quickly. And that is, we've covered again outreach, which is one to many, messenger, which is one to one, appointments, which is again building out a messaging intervention that once you build it out, no more phone calls. It'll all come into care message and you can review based on the message, the text sent out. We have referrals also, that if you handle referrals, you have an opportunity to go in and create a referral messaging intervention where the first message, again, utilizing smart text, will let them know that they have been approved for the referral. And if you could please call the clinic, whomever you're referring them to schedule their appointment to include that information. Message two can be sent every 2 weeks after the referral or a week after referral. And it will ask them again, you have an open referral. Have you scheduled your appointment? Please reply yes or no. If they say yes, it will update to the status to open schedule. If it's no or no response, the message will be sent up to 2 times within that week. Again, to really encourage. Once you build this out one time, you set it, you forget it, care message will do the rest. And then again, you have a third if necessary. Again, building out if they have not responded, same cadence as before, that if they say yes, then it will schedule itself to open appointment schedule, or if it's no, will send 2 times. And then lastly, it would be sent the day after the scheduled appointment, and they confirmed that they were going, asking the patient again, did you attend your blank referral type referral appointment? Text yes or no. If yes, it will update as closed completed. If it is a no, then it will encourage that patient to make sure that they will follow up with that provider. Please contact your specialist office to reschedule your appointment. So, all of that is built out once you build this one time. And again, we have our customer support managers as well as resources that will help you and walk you hand in hand to build out whatever your messaging intervention is. We are here to help you to be able to build that out. Then, last but certainly not least, we have our programs. Remember, we talked about our programs is that, again, we offer a 25-week program based on the diagnosis, whether it's around nutrition, exercise, type 2 diabetes, smoking cessation, stress management. This is just to name a few. But what your patients would do is, with their approval, and they accept to enroll or opt into the program, they would receive 3 to 5 messages per week for 25 weeks. And they would begin to really give them helpful tips so that they can take ownership of their health outcome. Let me show an example of what some of those messages would look like. Uh, in here, you will be able to see, again, all the messages that will be sent to your particular patient during that scheduled time. For example, message 5. How confident are you that you can make healthy choices to help lower your blood sugar? One, very confident. Two, confident. Three, not confident. Four, not confident at all. This will give you actionable insights as to how to be able to help this particular patient manage their health outcome. Another message that we see here, message 6. What type of diabetes medicine are you taking now? A, insulin, B, pills. C, both. D, not taking diabetes medicine right now. You can see here down, no matter what their choice is, got it. We will include information and tips about insulin. Be sure to take your medicine as your doctor says. Only take medicines that is prescribed to you. Again, based on whatever their selection is, they will receive this 3 to 5 times a week for 25 weeks. You'll also have an opportunity to be able to see what patients have been enrolled into this program so that if they have any questions, you will see a blue dot by their name under programs, and you have an opportunity to go in now utilizing Messenger one to one to be able to have that conversation with them. And then lastly, we have a summary. The summary is again based on, again, how many patients were enrolled, where they are in the journey, their retention rate, response rate. We even offer surveys. Unfortunately, these surveys are not customizable, but if you want to create your own utilizing outreach, using the multiple choice or the yes no, you absolutely can. But with these, you have an evaluation of the texting platform that they can respond and answer. We also include medication screening, user feedback, user satisfaction surveys, and medication evaluation as well. And then last but certainly not least is under programs, we also have social determinants of health classes, where again, it's a 4 week, a little bit shorter classes that will allow them to have information and resources when it comes to food, housing, and financial resources that are available. So, that, in a nutshell, is the Care Message platform from a high level demonstration standpoint. Do we have any questions before I get into pricing? Any comments or feedback? Excellent. I see we're making great time. Maddie, you had something?
No, I was just gonna say if anyone needed to put something in the chat, I can read it off for you.
Okay, fantastic. Pricing. Now we get to the fun stuff. Now, with with pricing, understand that with again, we work with FQACs, free and charitable clinics, as well as all other safety net organizations. There is no way we will price an FQAC the same that we will price a free and charitable clinic. The difference that we're able to do is that with FQHCs, we have a starting tier where you have 5,000 individual unique patients that you can message, which means you will have up to 5,000 patients in that first threshold. You can message them, text them as many times as you like without any additional charges being incurred. No data charges, no anything. It all comes with you being able to utilize CareMessage. Now, for FQHCs, in order to have 5,000 individual reachable patient tier, it would cost them an annual rate of $10,000. But for free and charitable clinics, we will charge you according to your annual operating budget. Let me give you an example just to kind of give you a scale. For any free and charitable clinic that has an operating budget of $0 to $250,000 annually, you will receive a 97.5% discount off of the use of Care Message annually, which now takes your rate from $10,000 annually to $250 annually. What we have also done is because we have now partnered with the Tennessee Charitable Care Network, is that we will also offer you an additional 20% discount with a 2-year commitment, which means now your rate to use Care Message will now go from $250 to $200 annually. Now, another thing about our billing is our billing cycle begins July the 1st of the current year to June 30th of the following year, which means we've already entered into our billing cycle. So what we have also done with Care Message is that there's no way we're going to bill you a full year cycle if you not had usage or commitment to Care Message. So what we would do is we will prorate you based on your rate, which again, if you fall within that threshold of your annual budget of $0 to $250,000, your annual rate of $200, we will prorate that based on the amount of days remaining in the calendar billable year. So that is a fantastic, again, that you're not being billed because you did not make a commitment within Care Message that's there. Now the Athena, for those who have Athena Health as your EMR or your EHR, and you are a part of Athena Gives, and you are part of our approved list of authorized Athena customers that will receive the Athena Gives pro bono rate. What we will offer for you is that we have two different rates. First off, we have the implementation build out. We will handle all of your build out. Our implementation managers and engineers, they will, with your permission, gain access to your data. They will build out your integration for you. You need no IT staff, anyone that you have to consult, anything of that nature, or really have to actually hire. We will do all the work for you. We will also set up 4 different scheduled testing labs so that you and your staff will have an opportunity to not only be trained how to utilize Care Message and the appointments via your EMR, but we will also make sure that everything is operating correctly, and then we will allow it to have your go live date so that you and your staff will be fully confident and know how to utilize this. With this, the rate for that is at $1,000 one-time fee, but for the Athena Gives customer, we have a reduction in that of 50% discount at $500. Now, I want you to remember you can utilize the appointments feature using a CSV list, or you can integrate it and allow it to be integrated within your Athena Health. For those who are on our list for the pro bono Athena Health opportunity, not only will you receive a 50% discount of that build out fee, but the reoccurring rate for the integration is $1,000. That's billed, of course, at the beginning of your billing period. If you're part of that list, Athena Health has agreed to pay 100% of your renewal rate or your reoccurring fee, which means your reoccurring fee would be zero. So, if I may recap to make sure that I'm explaining this correctly, when it comes to, again, Care Message patient engagement platform, we build according to your annual budget. Anyone falling, for an example, from $0 to $250,000, you receive a 97.5% discount, which would equate to $250 annually. Because of your membership with TCCN, we'll apply an additional 20% discount, which would drive your rate down to $200. Because we are already in the billing cycle, we will prorate that $200 based upon the amount of days remaining in the actual billable year. For those that have Athena Health and you're part of Athena API and you're part of Athena Gives, you will have a 50% discount for the implementation build out at $500. But for those who are on our improved list, the reoccurring fees have been waived. For those who are not, then the reoccurring fee will be $1,000. And you could please see me if you do have Athena Health, and if you want to know if you are a part of that list as well. So I know that was a lot of information to take in. I want to pause there and ask, do we have any question at all?
You guys are quiet today.
And I think this is being recorded as well too, Maddie, correct?
Yes, yes.
Okay, awesome, awesome. Well, team, please feel free to reach out to me if you want additional information, if we want to scale even further. Promise you, I'd be more than happy to assist you with that, to answer any questions you may have at all. I am putting my information, I believe, into the chat so that everyone will be able to have access to me. You can either email me or you can, again, see Maddie. That is my phone number. Let me put my email address in there as well. And please feel free to reach out to me at any time, and I'll be happy to assist you. Last thing I do want to mention, even though we're almost at the end of this grant subsidy, we still do have a few funds available, and that is for the Direct Relief Fund. If you visited the National Association of Free and Charitable Clinic website, you would see that CareMessage has been awarded the Direct Relief Fund, in which the Direct Relief Fund has agreed with a 2 year commitment that they would pay 100% of your fees for the use of CareMessage, and you would only be responsible for year two. So, again, that is not an uncapped subsidy, unfortunately, but it is kind of a first come, first served while the funds last. So, with that information, we definitely would love to make sure that I can reach out to you and speak with you. I see Corey. Thank you for reaching out, Curry. Awesome, Corey.
Sorry. Yes. I'm going to talk to our medical manager, Courtney Colson, who's also on this call, and we'll go through it. We do use Athena Gives. So we'll go through it and see what she says, but I'm sure we will have more questions after we discuss it and then contact you, if that's okay, directly to get more of a pricing breakdown.
That would be absolutely phenomenal. And I'm also happy to announce to you, Court, you are on that list.
Sounds great.
Sounds so exclusive. You're on the list.
Hope it's a good list.
I know,
It is,
right?
it is a good list. And everyone, whether you are or not, I promise you, we can make sure that we can make this affordable for you. We do have some other offers and opportunities that we can offer you for those who, again, maybe want to have an opportunity to utilize Care Message. Just message me, and I promise you, I can find a program that will work best for you. We just want to equip you to be able to really do even greater work than you're already doing in the communities that you serve. Thank you so much. If there are not any other questions, comments, or feedback, I welcome them all. Maddie, I'm going to turn it over to you.
Sure. Thank you so much, Daryl. We appreciate your time and giving us that deeper dive, although I still feel like that was still just kind of a surface scratch of everything that the platform can do. So
Mhm,
I just think it goes along really well with a lot of the programs that a lot of our members already are
mhm,
participating in, like breast and cervical cancer screenings. Just wants to have community health workers to be able to, promote some of those resources to address social determinants of health and vaccination updates and things like that. So I think it's a really good fit for a lot of the programs that I know a lot of our members already have. Um, so again, one of the things that's impressed me about Care Message is just the Daryl's responsiveness, and just, availability to answer any questions. And, I definitely believe that they're a company that's not just going to hand you this product and then be like, good luck. I think that they're here for you to help you make it work, which I know we all really appreciate. So thank you
Maddie,
so much.
you're welcome. Maddie, if I may, just one more thing, because you touched on something that's very important. We do offer so much support for you that we do have a customer success team that will also scheduling meetings once a month with all free and charitable clinics nationwide to be able to demonstrate best practices as well as house Q&A, and you have an opportunity to connect with other free and charitable clinics nationwide that are also utilizing care message. So it's all at your disposal. They're here to help you as well, be hands on to really get in and really make sure that you are successful. We will also send you training videos so that if you have volunteers, and we know how that may fluctuate at times, you can literally have a training video in your hand along with additional resources and a live resource to help your staff get up to speed. So that's it. Thank you so much, Maddie. I really and
Thank
thank
you
you,
so
T, so much.
much. Any last questions for Daryl? All right. Well, everyone have a great day. Thank you.
Thank you, everyone. Have a great week.